Hello everyone, welcome to UHD, a great place to work. My name is Danny Edwards. I'm the Recruitment Manager here at University Hospitals Dorset. Yeah, going to talk about the sort of jobs we have available, how to apply, the kind of careers we offer, a bit about our training. Going to talk about some of the staff benefits we have, why this is such a great place to work post our merger. Just waiting for a couple of minutes just to let more people join and just get the technical side underway. There'll be a place to on your screen once you've joined. You should have a box just to put any questions. So at the end we will have a session, a period of answering questions. So anything you put in there, I'll do my best to answer at the end, and then we'll also give you the email address to contact if we can't. But yeah, gonna do some questions at the end. So anything while I'm talking about, anything doesn't make sense or anything else you'd like to know, please do use that chat box and ask any questions at all. It doesn't have to be about recruitment, about HR in general, about the careers, or how do I become a nurse, anything like that. Just use that chat box. Yeah, so we're going to get underway in a minute. Also going to talk about our trust values, which obviously new trust values. Since our merger, we've agreed values across all our locations for UHD. Okay. Yep. Okay, lovely. So thank you for logging in, everyone, and for our first virtual open day. And hopefully next year we can see you all in person and perhaps show you around some of the departments at the hospital, but we're going to do our very best virtually, just to talk about our values, what careers we have on offer, and the kind of places you can work in the hospital. So my name's Danny Edwards. I'm the Recruitment Manager here at UHD. I joined in December, so I'm still quite new, but lots of exciting things going on. Could we have the next slide, please? So just to start off, before we talk about the different roles we have, just talk about our values again, because we really do look for people to join us who share these values. And we're just going to play a very short video, about 1.5 minutes long, just to sort of show some of our colleagues talking about these values. If we could have the video, please.
We are here every minute of every day of every year, no matter what happens. We are caring and see the human side in each of you.
We have big hearts and treat our teammates with compassion and kindness too. We are one team working together, always striving to be efficient and helping everyone to learn and grow.
We are listening to understand. We believe everyone has a voice and that your views matter, and so does how we act on them.
We are open and honest, always endeavouring to learn and do better, encouraging everyone to speak up so we all feel safe and supported.
We're always improving with groundbreaking new care, better ways to communicate, and well-being support for our staff.
We are inclusive. We are Mukhtar, Dan, Judith, Margaret, Tammy and David. We are proud of who we are.
And whoever you are, there's a safe space for you here too.
We don't do it for the thank yous, we do it for you. We repair lives, welcome new ones, and honour goodbyes. We're always here with a smile.
We are staff, but we are patients too. We are Team UHD.
Okay, brilliant. I think that's a really good video because it kind of shows our values, it shows some of our staff, and it kind of sums up in 1.5 minutes, I think, what UHD as an employer strives to be about. Just to talk about inclusivity for a minute, we do believe an inclusive workplace is really important in our culture and towards the care we give our patients, which are, again, obviously from all different backgrounds, ethnicities, ages, religions. So we do have we strive to be an inclusive employer, and we have a number of staff networks that staff can join, including the Armed Forces Support Group, the BAME network, the Pro Ability staff group, who represent staff with disabilities, and other staff networks as well. So we do aim to be inclusive. Okay, next slide, please. Okay, so there's some of our values, but what kind of careers do we offer? So we've got, firstly, as you'd expect, we have a wide range of clinical and medical careers in all different specialities and areas, a massive wide range of roles. Post the merger, it's a really exciting time to join us. As you'd expect, obviously, all our clinical services are being reviewed. There's a lot of opportunity for internal promotion. To give you an example, in 1 week on the 6th of September, 25 people started new roles internally within the trust, as well as over 50 people joining from outside. So there's a lot going on, a really exciting time to join. And obviously, just to mention the location, we're very fortunate being on the south coast. We've got fantastic beaches on our doorstep, as well as the New Forest right there. So it's a great place to relocate if you're a clinician in a different area of the country. I relocated from Oxfordshire about 4 years ago, and I really enjoy living in this area. Recently, we became a university hospital, partnering with Bournemouth University, and as time goes on, this is going to give us some really great training and development opportunities. So if you're a clinician, this really is the place to be. In terms of starting your career in healthcare, healthcare support workers, really, really important. Members of the team on the wards, work in all different areas, and we pride ourselves on providing some of the best training for healthcare support workers. And we also have internal pathways. So some of our registered nurses started with us as healthcare support workers, have now worked their way up within the trust, still working, still earning money, and now registered nurses without having to leave to go to university. So that's really, really good. And obviously, some of our support workers, it's a role they enjoy and they do it long term. And all different areas, obviously, we cover, including the emergency department, theatres, maternity, and outpatients. It's a brilliant way to start your career. But obviously, you think hospital, you think healthcare roles. What else do we offer? And this is probably lesser known. We have many, many, many different roles, huge numbers, come up. We have a very diverse workforce. So we've got project managers, housekeepers, porters, receptionists, secretaries, electricians, accountants, recruitment managers, HR advisors, IT, desktop technicians, many roles, support secretaries, PAs, available. So as a place to progress your chosen career, whether it's healthcare or administrative or estates, ancillary, catering assistants, it's a really good place to work. We've got a lot of roles available. So whatever your type of career, your next role could be at Bournemouth, Poole or Christchurch. Could I have the next slide, please? So how do I apply? So this is quite simple. There's obviously on the internet, there's many different places jobs are advertised. There's dozens of them. But to work for us, you only need to go to one place, which is uhd.nhs.uk/careers. All our vacancies are on this website. And obviously you can see the different sectors. So you can click in there to whatever type of role you're interested in. And it does change a lot. I mean, we've got I think north of about 11,000 staff now. So we're a big organisation, so it does change a lot. So the biggest message I'd say is if you log on today, have a look, there's nothing suitable, try again next week, have a look, because it changes all the time. I mean, I work in recruitment and I can attest that my team and I, it changes a lot. We're very fast moving, dynamic organisation. So if there's nothing suitable, check next week. You can also register for job alerts on our website and on NHS Jobs to get automatic emails. But I always find actually going in and checking individually does work quite well as well. Okay, could we have the next slide, please? So you found a job you want to do. How do you apply? So just a little bit about this. Obviously, for some of you, this won't be this will be what you do already, but we do receive a lot of applications, and they may be from people who are very skilled and would be very valuable, but sometimes the applications just aren't, there's not enough information there to really sell the person who's completed it. So I was going to talk a little bit about how to give yourself the best chance to get an interview. So when you're ready, obviously press apply now. Make sure you read the advert and job description really carefully, and make sure the application is tailored to the job you've applied for. If you apply for a job on our website, you can use a previous application for any new jobs. So you don't have to do it from scratch every time. You can copy it across, which is a brilliant feature. But when you do that, just make sure you tailor it for the new job. You don't want the manager to read that you really want to be a support secretary in an emergency department when it's a role in the acute medical unit you're applying for. And we do see that sort of thing. So tailor it for the job you're applying for, and make sure you complete every section of the application. Another document, as well as the job description, that's always attached is the person specification. That's on all our adverts. Really important document. Make sure you read it, and it has all the essential and desirable criteria. So once you've done your application, make sure you kind of refer to the person specification, and just double check you've kind of covered all the essential criteria. And that if you've done that, it's much more likely you'll be shortlisted for an interview. If you're not shortlisted, don't be discouraged. It feels, I mean, I've had it myself when you apply for roles. If you don't get selected for interview, especially if it happens 2 or 3 times, it's very easy to get discouraged and take it personally. But I would say please don't. We do sometimes receive large numbers of applications for certain roles, so it varies a lot. So if you haven't been successful, we will let you know either way. If you haven't been successful, it's always worth trying again. And again, look at that person specification. Sometimes on the personal statement on the application, sometimes what I've done personally in the past is put the criteria into that, and then just kind of made sure that every criteria I've met. And obviously just get someone else to read through your application if you can, for spelling mistakes and grammar. It's much easier to have someone else look at it, especially if, like me, I'm very dyslexic, so I'd never write an application without asking someone to proofread it for me. Okay, I think that's everything on that one. Yeah, okay, next slide, please. So after you've applied, Track Jobs is our recruitment partner. So all applications, so medical applications will be via NHS Jobs, and all non-medical will be via Track. Whichever system it is, the manager will shortlist the candidates, and then they'll select the ones for interview. So we do, as a trust, always aim to let you know whether you've been successful at getting in the interview or not. If you ever have an instance where you apply and you never hear anything, do email recruitment at uhd.nhs.uk. That email address will be in the chat box as well. But we aim to always let you know one way or the other. If you have been successful, the manager will contact you electronically to arrange the interview. It may be over Teams, especially if you live some distance away. We would never expect people to travel hundreds of miles to come for an interview. And obviously during, with it being the pandemic, some roles are still over Teams, virtual. Some are face-to-face, some are over Teams. There may be an assessment. You'll be told about that well in advance. For their healthcare support worker roles, we do maths and English tests, because fairly basic ones. Obviously, we need to ensure the very best care for our patients. Okay, so yeah, our managers all receive recruitment training, so you should have a very good experience. And obviously, I'm not going to go into a lot of interview technique because it's a very big subject, but obviously try and again do a bit of research and try and relax. Think of some examples from your past experience. That's quite an important one, because we do use a lot of competency and values based. So we might ask you, describe a time where such and such has happened. I've always found it useful to have sort of 4 or 5, just think about anything memorable that's happened in your job role, any times where you've performed really well or you're really happy, you got some really good feedback, anything like that. So just try and keep that in mind. But most important thing is to relax. Remember, interviewers can be nervous as well. So, go and be yourself and try and give a really relaxed interview if you can. And obviously managers will let you know, and our managers should give you interview feedback. So if you're not successful, you'll have some feedback to take into account for the next time. Okay, next slide, please. Okay, so now we're going to hear from Carla Jones, our Deputy Director of HR, about some of the brilliant staff benefits. If you are successful at interviewing, you join us, this is some of the benefits you can expect to receive.
UHD is based in a fantastic part of the country. We're right on the south coast, and which offers fantastic opportunities for outdoor leisure activities. It's a really great place to work, and should you choose to join us, you will become part of a talented My name is Carla Jones and I'm a Deputy Chief People Officer at University Hospitals Dorset, UHD for short. UHD is based in a fantastic part of the country. We're right on the south coast, and which offers fantastic opportunities for outdoor leisure activities. It's a really great place to work, and should you choose to join us, you'll become part of a talented, caring team who do all they can for the benefit of our patient. In addition to the obvious job satisfaction that working with dedicated colleagues brings, as well as our patients, we enjoy a number of personal and financial benefits, some of which I'm going to talk to you about today. So we enjoy a generous, very generous annual leave entitlement of 27 days on joining the organisation. This increases to 29 days after 5 years and 33 after 10, in addition to the usual 8 bank holidays. So we have relevant access to on-site accommodation and relocation support, and a very generous pension scheme. There is also great development opportunities for all of our staff. At UHD, all staff have an annual personal development review together with a personal development plan, which enables staff to reach their career aspiration. We also place a huge importance on staff well-being, and we have a number of outdoor spaces where staff can take rest breaks. These are in lovely surroundings. We also have a fantastic occupational health service, which includes counselling. Staff also have access to a number of discounts with a variety of organisations across the UK, which allows them to make savings on travel, retail and food. We also have access to discounted food and beverages in our staff restaurants. We also have a salary sacrifice scheme that enables staff to purchase cars, bikes and cycling accessories to enable them to commute to work. This also allows them to make savings on their national insurance contribution. We recognise the importance of our staff being able to balance their home and work life, and there are opportunities for flexible working and support for new parents, including an on-site nursery and those with caring responsibilities. Why not look into joining us by visiting our website today?
Thanks, Carla. So that's just some of the benefits we offer. Obviously, very good annual leave. As someone who worked in the private sector for some time, yeah, I can personally say the extra annual leave is very welcome. And I do use both canteens at Paul and Bournemouth regularly, and the food is very tasty and very good value. So, you know, a bit of personal experience to that. So, yep, brilliant. Next slide, please. So obviously, once you've joined us, particularly if you're a healthcare assistant or someone new to healthcare for the first time, an induction and feeling, you know, confident to treat your first patient, really important. But for everyone else as well, obviously, it's important to have training, a good training and induction, so you feel welcome and you feel confident to start your role, whatever type of role it is. We have all different inductions and training ongoing as well. And here's Tom, our Pool Site Training Manager, to tell you a little bit more about that.
And I'm the non-clinical training manager here at University Hospitals Dorset. I'm here today to talk to you about the training and education opportunities here at the Trust and how you may be able to take advantage of those on your own journey with us, should you choose to join the team. Now, if you can go to the next slide. Firstly, I want to go through a couple of facts with you, because did you know the NHS is actually the 5th largest employer in the world, which is massive. And on top of that, it's also the largest employer in Europe. So it's a big organisation, and it covers a lot of trusts across the land. Yet, despite that, it still feels like a small community. And in that small community, like any other small community, we have roles and opportunities in all different areas, because we have catering, we have car parking facilities, we need people to look after our IT systems. We also need people to look after our buildings and maintenance. So we have our facilities and maintenance team. We've got teachers, we've got carers, we've got plenty of other roles which are both clinical and also non-clinical that some people, including myself, before I joined, wouldn't have even have heard of. So there are hundreds of opportunities across the NHS Trust. And what I want to talk you through is just how you can get involved with those, but also the kind of education and training that is available to help you on that journey. So if you can go to the next slide. Because the first thing I want to take you through is our healthcare support workers. Now, our healthcare support workers are some of the beating heart of the team. They really do keep the trust running. Because our healthcare support workers work across a variety of settings. And they can go all the way from mental health through to children's services. Now, a healthcare support worker in that job role is for someone with limited or possibly even no hospital experience. And what the programme looks to do is to train that person to work in a hospital and be able to perform basic tasks to help our teams do what they need to do. When you're ready, you're able to progress to more advanced procedures such as cannulation, venipuncture, and the opportunities to progress are honestly endless. You can choose to specialise in a particular setting, or you can train to qualify as a healthcare professional, such as a nurse or a midwife. And it is a very hands-on role. So 1 minute you could be taking blood, the next you could be lending an ear to an anxious patient. Who knows what every day is going to hold? But it's one of the most rewarding roles within the trust. And your day-to-day will vary depending on where you are. So it could be absolutely anything you're doing, from helping patients moving around to making patients feel comfortable. It could be performing basic health checks and monitoring patients. There is absolutely loads to do. And what is great about the healthcare support worker role is it's a fully supported role. So I'll talk about inductions in a little bit. But as part of being a healthcare support worker, you'll go through a week-long intensive training course to upskill you enough to work with us here. But all the time that you are a healthcare support worker, and after that week's training, you'll be under the supervision of a qualified healthcare professional. We also offer callback days to make sure that support goes beyond just that 1 week of training. And there are tons of opportunities to help you along in your career should you choose to take this path. Now, if you can go to the next slide for me. The next opportunity into the trust from a training perspective would be through apprenticeships. Now, apprenticeships exist outside the NHS. They exist all across the country, and they're a fantastic way to upskill yourself and to learn whilst also earning in a full-time role or possibly a part-time role. It's not just on the wards that we offer apprenticeships. So whether you're interested in a career in customer service, administration, team leading, clinical healthcare, or other trades, we have possibly got an apprenticeship for it. So if you're anywhere over the age of 16, then you can apply for an apprenticeship and you can come onto the apprenticeship scheme, and that is subject to you paid the national minimum wage for apprentices. Apprenticeships take between 1 and 5 years to complete, depending on the course itself. If you're over the age of 16, anyone can do one. You're likely to, they differ based on courses, but you're likely to spend 4 days with us on work placement and then 1 day in a training centre or a college to supplement your learning. So you've got that real blend of on-the-job practical learning of the theory that you're going through, but equally you've got that time put aside to really make sure you can understand all the skills that you need and all the knowledge that you need in order to qualification. You'll also gain a competence qualification, and that could be that will be based on what you can do in the workplace, and then also we offer support with English and Maths should that be something that you also need support with. NHS apprenticeships generally sit at 4 levels. So our entry apprenticeships will either sit at level 2 or level 3. So that will be at sort of GCSE level or A level. And that will be our advanced apprenticeships. And then once you're with us in the trust, there's still opportunities to progress and there's still opportunities to undertake apprenticeships. And there'll be either higher apprenticeships level at foundation degree or above, or there could even be degree apprenticeships. So that's equivalent to a full bachelor's or even master's degree. So there are endless opportunities with apprenticeships. So if you go to the next slide, please. Because once you're with us, the support doesn't stop there. So depending on your job role, and depending on what you're doing with us here at the Trust, you'll go through an induction. Now, we have multiple inductions supporting all different types of staff, and it will be tailored to your role. So it'll be the perfect time for us to get to know a bit about you, your aspirations, and what you want to achieve whilst you're with us. But also, it's a great time for you to get to know us. Our vision, our values, our ambitions, and the structure of where it is that you'll be working. We offer tailored support for groups such as I said, our healthcare support workers I mentioned earlier on. Groups such as our newly qualified nurses, those nurses that are bringing valuable experience by joining us from overseas. We've also got a tailored support for those that are returning to nursing after some time out, and then also for our junior doctors as well. So there is plenty of tailored support on offer. You've also got access to world-class and leading IT systems and leading e-learning platforms. So we have an e-learning platform here at UHD called the BEAT VLE, so Virtual Learning Environment, and that's where you can constantly update your skills and knowledge. You've also got use of our state-of-the-art simulation suite. So for those clinical skills that you need to physically practice, we have a simulation suite for that. We also support our clinical educators to help you develop those practice-based skills. And then also outside of that, whether it be personal effectiveness, resilience, leadership, whatever the topic may be, our organisational development team have a whole range of courses geared towards personal development and those opportunities. So if you can go to the final slide for me. Thank you very much for listening. Like I said, my name is Tom. And if there's any questions, please do let us know. But for now, I'm going to hand you back over to Danny, and he will now answer any questions you may have. But if you want any more information about the education and training team here at UHD, don't hesitate to get in touch with the recruitment team.
Thanks very much for that, Tom. That was slick, wasn't it? It's almost like it's all live. Yes, thank you, Tom. Yes, so that was a really good overview of some of the training we offer. And just to give you an idea, just to add that our healthcare assistants actually do 10 days full-time training. So it's a really good, manual handling, all the other things Tom mentioned. So yeah, really, really good training available here. So that was brilliant. So now we're going to move on to enough of us in HR talking. We're going to hear from some of the people on the wards. So we're just going to hear from our maternity department, who are either recruiting at the moment or they're going to be recruiting for midwives fairly soon. So if you're a midwife who's would like to live by the beach, do keep an eye on our website for that. And if you're interested in knowing what it's like to be part of the team, have a look at this video. They're going to talk about it now. Just re-queuing that video, just be a minute.
Hi, I'm Lucy and I'm a midwife here at University Hospitals Dorset. I moved to Dorset 4 years ago and I've never looked back. My favourite thing about living here is being near the sea. I have taken up paddleboarding on Mudderford Quay, which is a great way to relax in the summer, or winter if you're adventurous. The team I work with are really caring and supportive. I felt at home here as soon as I joined. We usually plan a few social events throughout the year. Since I've been here, I've taken part in an escape room, been for meals out and some really great Christmas do's. The Trust also hires out beach huts to our staff, so our team usually organises a get-together at the beach each year, where everyone can bring their children and their dogs and have some fun. So if you're considering a move this year, look no further than the beautiful coastal county of Dorset. We would love to have you.
Hi, I'm Georgia and I'm a midwife based across Bournemouth and Poole. I really love having the opportunity to work across the two sites and be involved in antenatal and postnatal care, as well as caring for mothers in labour. Not long after I moved here, I was able to move into a post caring for women with multiple pregnancies, and I'm learning so much along the way. There is a lot of excitement in our trust at the moment, as building is starting on a brand new maternity unit on the Bournemouth site. As midwives, we have had the opportunity to be involved and help to shape the new unit. Living in Hunworthy, I have easy access to the New Forest, and whenever my parents come to visit, we are able to take the dog out for long walks and let him off the lead. I've also been able to go on a few boat trips since I moved here, exploring some of the local attractions like Old Harry Rocks and Brownsea Island, which are just on our doorstep here in Dorset. I would really recommend University Hospitals Dorset as a great place to work with lots of opportunities.
Thanks, Lucy and Georgia. So yeah, gives you a bit of an idea about what it's like to work as part of that team, and I think that kind of experience is mirrored a lot of the teams. We've got really passionate people, and yeah, great place to live as well, obviously. Okay, that's the end of our talk. There's a lot more information on our trust website, so that the link UHD.nhs.uk/careers. There's a bit of information about our various roles, as well as just job adverts. I'm going to have a look, see if there's been any questions now, and do my best to answer them. So I'm just having a look in the chat. So someone has asked, are there any roles that would be suitable if I don't have any A-levels? The answer is yes, absolutely. We do aim as an HR function as an employer to really value experience as well as qualifications, and we really only try and insist on qualifications if they're essential. Obviously, someone has to be a registered nurse to do a registered nurse's role, but we don't stipulate those kind of things. Obviously, having A-levels can be an advantage, but you know, for example, if it's a secretarial role, we would never say A-levels are essential. We would always say A-levels were desirable, A-levels or previous experience in a similar role. You know, so if you have good experience for a role, you would not normally need A-levels as well. So again, it all comes down to the person's specification. So yeah, we have depending on obviously your background and your career, we are most likely to have all different roles available even with no A-levels. And certainly for things like our entry level roles, such as, you know, catering assistants, porters, healthcare assistants, administrative assistants, yeah, we don't specify A-levels on those, as I know some employers do. So car parking facilities at the sites. So car parking is limited at both sites, and not every employee will get a car parking pass. We have got issues with capacity. Obviously, we have to ensure our patients have, you know, plenty of parking available. So staff parking is limited for that. There's no quick answer to this. It varies on how far away you live. You know, if you were to join us with a medical condition, we would certainly take that into account. What shifts you work takes into account. So I can only really say everyone has the opportunity to apply for parking, but it is not a given. And there are places to park. In Poole Hospital, there's you can get a permit to park on local roads for a cost from the council that's a bit cheaper than if you didn't work for the NHS. And at Bournemouth, there are local roads you can park on. We have an arrangement with the village at the Little Down Leisure Centre opposite with a certain amount of parking. But yeah, parking is not guaranteed, unfortunately. But depending on where you're commuting from or the type of shifts you're doing, you would certainly be able to request it. And if it's a real concern, once you've applied and you're offered the role, you can speak to the manager, who can speak to Travelwise, our parking partners. Okay, so is there a good pension scheme? Yes, the NHS pension scheme is very good compared to certainly the statutory minimum. I can't quote the percentages off the top of my head, but it's vastly better than what the kind of government mandates pension scheme is paid. Compares very well to many private sector pension schemes. So you put in a certain percentage and it's more than met automatically. So it's a very good pension scheme compared to, I would say, most pension schemes out there. Have we had any other questions come in at all? No. Oh yes, I'm going to scroll down. What makes UHD stand out from other hospitals? I've worked for 2 other NHS trusts. Personally, from a personal perspective, I think there is a lot of collaboration. So in the NHS, sometimes you get a lot of we really collaborate, we really help each other. We work very closely together, and I think the merger, that's really happening more and more, because there's a lot of communication, because obviously there's a lot of processes that were different at Paul and different at Bournemouth and different at Christchurch, and obviously they're being brought together. So since I started in December, I feel like I've met people from probably in almost every department at both hospitals, and it's been really, really good. So I'd say it's a friendly place to work. And I think our trust values and our staff networks are things that set us apart as well. Not every employer has that, and I think we really go out of our way to support staff, no matter their background. So yeah, we put a lot of work into career development. Absolutely, does the trust put a lot of work into career development? Yeah, there's a lot of adverts. Everything is fair and above board is our aim. So internal roles are, if they're longer than 3 months, are advertised for anyone internally to apply for. So we get a lot of people who move jobs but stay with us. We do retain a lot of good staff because we give them the opportunity to grow as much as possible. So yeah, we do put a lot of work into career development, absolutely. And with the merger, of course, functions changing. We went from being 2 small trusts to a 1 large trust. State-of-the-art maternity, state-of-the-art theatres. It's going to be tremendous amounts of opportunities to progress your career with us, absolutely. Anything else at all? Oh yeah, I need to start scrolling down because I don't see them. So University Hospital Trust. Thank you for this. So it means we're partnered with Bournemouth University. So we are partnered with them. They provide us with training opportunities, and placements. They place their students with us. So it really means that we get a lot of academic support, training support, to move on as a university trust, and that's only that will get more and more in the future as well. So there's going to be a lot of mutual benefit observing both ways, and they have excellent facilities as well that some of our staff will be taking advantage of in the future, including a brand new building. All right, thanks, Jamie. Do we pay the relocation costs? So relocation costs, we do. So yes. So if you're moving a long way and you're having to move house and incurring significant costs, there is an application form, and it will depend on the circumstances, the type of role. But we do have a budget for relocation costs, unlike many other hospitals. So yeah. So if you live a long way away, you can complete the application form. We may be able to help you with some or all of your relocation costs. Yeah. Just seeing if there's any more coming in. Just see if there's any more. Okay, so someone's asked about what schools are like locally. So I think, yeah, I mean, I believe there's quite a lot of very well rated schools locally. I haven't got children myself, but I know my sister-in-law, her kids go to Ofsted good rated schools, obviously Twynham School in Christchurch. So yeah, some very, very good schools locally, and a lot of it's a brilliant place to live, to have children generally as well. There's a huge amount to do in the local area. Very good schools. I think we've just got one more question coming in. And oh, someone's asked about house price. Obviously, someone on the chat is thinking about potentially relocation. So the area it's obviously it depends where you're moving from. Is the short answer. Obviously, if you're moving from the centre of London, prices are going to be very, very competitive around here. It's going to feel cheap. If you're moving from the north of England, perhaps not so much. But Yeah, so house prices vary across the area. I think they're a little bit higher than the national average, but yeah, it is a lovely place to live, and obviously there's all different. There's different. Some areas, it's a little bit further out, are definitely cheaper than the ones in kind of central Poole and central Bournemouth. So it depends where you're moving from. It's all relative, but it's not the cheapest place to live, but in my opinion, it is one of the best. Okay, lovely. Thank you very much for joining, everyone. If you've got any questions, if you didn't have a chance to type anything in, or if you've got any other questions, do email recruitment@uhd.nhs.uk and we'll be happy to answer you. Thank you for joining. Bye-bye.